Ladies and gentlemen,
this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host,
the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hi everyone, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week was a former law enforcement officer who worked as an investigator for the Texas Dental Board. He later became an ally of the dental community and started his own company called Dental Compliance Specialists, consulting with dentists and their practice to prevent any concerns with government health agencies. Currently working from Dallas-Fort Worth, Texas, please welcome the tooth cop, Duane Tinker. How's it going, Dewayne?
You know what? I can't complain. Life's pretty good.
Nice. That's awesome. Now, to catch everybody up, where we met was actually at the Voices of Dentistry earlier this year, where we had met, had some time, and you shared quite a few good stories with us. But to get everyone up to pace here, in the beginning, what was it that actually drew you from law enforcement toward dentistry?
So I grew up, I was a law enforcement officer, and I kind of ran into a crossroads in my career. It was time for me to get off the street and do something different. And I guess I woke up one day and realized how dangerous my job was. And, I guess being woke at that moment, I realized, holy cow, I need to do something different. My wife and I were raising 5 kids. And long story short, I had a friend of mine that worked at the dental board in Texas. And, she and I talked and she said, I need a good investigator. Why don't you come work for me? And I was kind of flippant about it. And I said, oh, what? And be a tooth cop? And, that's kind of how my brand was later born from that smart comment at that moment. But so I literally was a police officer for the Texas Dental Board. And, I worked for the board for 2 years and investigated naughty dentists for a living. And that's where, my law enforcement world merged with the dental world. And I fell in love with dentistry. I just really like working with dental offices and dentists in particular. They're kind of quirky, and I like that because I'm kind of quirky,
Yeah, that's a good fit. Now I know that you grew up in Minnesota. Did you practice law enforcement there, or was it after you moved down to Texas?
I used to work. I went to police academy in Minnesota, and shortly after I finished the academy up there, my wife and I moved to Texas. So no, I've always been a Texas lawman. So only been a Texas lawman.
Now, initially working as an investigator for the state dental board, you were looking for certain things that may have been violations in the dental practices, and now you've switched gears and you're working for helping doctors to avoid those type of situations so that they can be free of that and run a healthier practice. Was there ever a deciding moment that made you realize that you needed to work for the other side?
Actually, I kind of had a convergence. There was a few things that kind of happened at the same time. One, I loved working for the board, but working on a cop's salary, raising a large family, you're always looking for opportunities to work off duty and make extra money, and so that I've always been an entrepreneur, and I work in my cases day in and day out. I met a lot of really good people, and it was completely different from a traditional law enforcement. And I realized there's a lot of really good people in dentistry, and I saw an opportunity to maybe share my experience with people and maybe grow a business out of it. And, just kind of came together at one time. But I guess there was a specific incident. And I walked out of a dental office one day after investigating the case with what I thought was a good dentist and a good staff. Mm-hmm. And there were some things that had happened in the case that I knew that they were likely going to get in trouble for. Things I couldn't sweep under the rug per se. But, it really convicted me when I walked out of there. I've always kind of had a gift of mercy, and I think that's where I kind of align with the way a lot of dentists think. They all have these hearts of compassion, and they for their patients, and me for the people that I was working with, dentists in this case. And I just thought there has to be a better way. I mean, most dentists and most staff don't set out to get in trouble. They try to do the right thing, but they sometimes just don't know what that is. Mm-hmm. And I thought, man, if I can share my experience and kind of bridge that gap, and, make a difference for people to make the office safer for everybody, not just patients, but also the dentists themselves, because there's so many different regulatory risks that they face, and try and even the scales a little bit.
So, Dwayne, in your experience of working as an investigator for the state dental board, did you ever have an awkward situation where you're conducting an investigation and someone in the dental practice was taking it extremely hard and actually turned toward a suicidal type action?
Kind of funny you asked that. Actually, I talked about that a little bit here recently. When I was with the board, I actually had 2 dentists that committed suicide during my time, and it kind of hit home for me. They say that dentistry is stressful, and I didn't at that moment understand exactly, the stress that dentists, endure. But in the years since then, and working with dentists like I do, and I hear their concerns, I hear the things that trouble them, and fortunately, it is a pretty rare thing. But I understand now the stress that dentists face. They tend to be perfectionists.
Now, in your services, what are the top 3 services that you provide for dental offices?
Training, auditing, and training, auditing, and inspections. I guess auditing and inspections kind of the same thing. Mm-hmm. So we do record audits, and we also do office inspections.
Now, do you physically go there to investigate offices? How's that done?
I don't like to use the word investigate. Audit.
Sorry.
Maybe. That sounds like an interrogation.
Yeah. We're on the other side of that now.
I do. Yeah, and I don't even call them audits really, because there's still that stigma to it. But people bring me in because they want me to look in their practice and help them identify what they're doing well and opportunities to maybe make their practice safer.
Mm-hmm.
I like to call them consults.
That's good. So, I like that.
Yeah, so it works. And I'm always careful in the language that we use in our reports and things. But I do quite a bit of in-office inspections. I do a lot of virtual inspections, like by live video, and then record auditing. We typically remote in to our client's server and their practice management software, and select records to audit.
Gotcha. Now with that live video, are you using like FaceTime on that, or how can you share us a little bit more about that process?
Yeah, we use Zoom actually. I think everybody's heard of Zoom, and it works really well. Everybody can access it on their smartphone. Everybody has a smartphone, and we just use the tools that they already have in their pocket, and it works really well. Especially since most cell phones have a forward-facing camera that
Yeah.
They can give us a tour around the office. And, we've got a checklist for different subject matters that we go through, and it works pretty well, surprisingly well.
That's awesome. Now, have you noticed that there's any states that are more consistent in reaching out for your services?
I wouldn't say by state. Usually, maybe a state of mind of the dentist. Just like a dental practice and dental patients, we push prevention, but people always buy pain relief. And dentists are kind of the same way, oddly enough. And I don't know why, because, you'd think they practice what they preach, but, they preach preventative dentistry and dental hygiene to their patients, but yet they call when they have the root canal. Most of the work that I do is preventative. People that are not in trouble, that are just trying to, do things right, trying to stay under the radar, trying to, not have any problems that can blow up in their face, if you will.
Yeah.
But I've pretty much positioned myself to be that guy that people call, when there is a problem, when, the FBI is kicking down their door, seizing their servers, when, a patient dies and, dentist is having to make a self-report to their dental board, to inspect the office and make sure that everything is, identified and fixed before the dental board comes in to do their investigation, not to sweep anything under the rug, but let's just be honest here. If there's a problem, and we correct it before the board shows up to do their thing, there's no problem unless they can see evidence that at the time that the office wasn't compliant. So, nobody wants to look bad in front of their state dental board. So, I help people put their best foot forward.
That's awesome. Is it fairly common that you'll find, say like a small concern or something that the dentist wasn't even aware would be a concern or issue?
In every single office and in every single record. Absolutely. Yeah.
All right. That's
so
sounds like it's important to get that consultation then.
Yeah, I think so. And, I know that what I do really makes a difference for the people that I work with, but, it's a tough sell. And I'll tell you why. It's very simply that you can't calculate or attach a return on investment. It's not like, many with the tax guy, learning how to reduce your tax liability or learning how to grow or market your practice, where you can tie that to, bringing in X amount of additional dollars to the practice. What I do is really about, like, it's kind of like insurance, helping people protect the investment that they've made in their practice, maintain efficiency in their operations, and of course, ensuring the safety of their patients, their staff, and even the dentists that we work with. So
right,
it's hard to put a dollar on.
Yeah, no doubt. It could be something where somebody hears a little squeak in their brakes, almost takes it to a mechanic, and they discover that there's something else that could be potentially life-threatening going on with their vehicle that can be addressed at that time.
Yeah, the hubs are falling off.
Now, obviously, this is a very important service that you're providing that can help out a lot of dentists. Where would they be able to find your information?
I have a podcast. Can I talk about it?
Yeah.
Okay. So we've got a website, dentalcompliance.com. The name of our company is Dental Compliance Specialists. And I actually have my own podcast, which is called Talking with the Tooth Cop. Yours truly. And I talk about different risk and different compliance issues and, kind of from a unique perspective, not to beat people over the head, but really try to make it real conversational and informative, about the risks that dentists and dental offices face in a number of different areas. So come join us. Check it out.
Yeah, just like we addressed earlier there, that a lot of doctors have a certain something going on in their office that they don't even realize is a violation of concern. So that's awesome. We'll make sure and have those links in the show notes here below too for our listeners.
That's great.
And now for doctors that are coming into the field, new doctors coming into the field, do you have any advice that you'd be able to share with them? Yeah,
definitely. Coming into the practice, a couple of things. One, you have an untarnished reputation, and it's up to you to establish your reputation, good, bad, or otherwise. Yeah, so it's up to you to identify what your values are and protect your integrity. Adhere to your values and don't compromise from that, because you'll likely encounter situations where somebody will ask you to do something questionable and potentially violate your values. Two, I would say, seek to understand the liabilities that you face. Understand if you're working as an associate or for a DSO, understand your liabilities, even working in that environment. Understand how your credentials are used and how your information is credited to, the claims that are submitted on your behalf. And, that potentially expose you to liability that or that expose you to indirect liability just based on the fact that your credentials are used when the claims are submitted to insurance or Medicaid programs. Because even if you have no actual knowledge or actual involvement in, say, criminal fraud, even though because your credentials are used, the government really has an easy time proving willful fraud in such instances, even if the dentist doesn't have any direct knowledge that it occurred.
Gotcha.
It's not fair and it's not right, but you need to understand how your information is used nonetheless.
Yeah, no, it's a very true thing. Absolutely. Well, Dewayne, I really appreciate you taking time out of your day to meet with us on the podcast. Hopefully we're going to see you next year at the Voices of Dentistry as well. Are you going to be there?
Absolutely. You know what? I probably won't miss another one. I had a great time, met a lot of really good, a lot of great people, including yourself. So
yeah, that was fun. I was glad we got to meet.
Yeah, for sure. So thanks a million for having me, Brendan. I appreciate it.
Yeah, my pleasure. Thanks for coming on. Take care of yourself.
All right, you too. Take care.
Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.